You're listening to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. I'm going to have a conversation with Dr. Joan Merrill. She's joining us here from the Oklahoma Medical Research Foundation, talking about a new phase 3 data that was presented during the annual European Congress of Rheumatology dealing with arthritis. Welcome to Health Professional Radio, Dr. Merrill, and thank you for taking the time.
Thank you.
Well, give us a bit of your professional background, if you would, and talk about some of your work there with the Oklahoma Medical Research Foundation.
Well, I've been with the foundation for about 20 years, and my interest is in lupus, which is a very complicated autoimmune disease that affects how the immune system responds to things. And people tend to develop what used to be almost completely unpredictable flares of inflammation that can affect almost any part of the body. So one of the things that we've been doing is sorting through with newer technologies what goes on when that happens, what changes, how does the immune system, the components of the immune system sort of work together in myriad ways to produce these symptoms. And so that's part of the work that is being done there by a group led by Dr. Judith James. But I've been working with that group in recent years to try to apply this to clinical trials. The complexity of understanding lupus is a real challenge because not only do these patients have different ways in which their immune system goes awry, but also they're all on different background medications. These medications are changing the set point of what we're looking at. When you want to test a new drug, you're working against complexity on top of complexity. So we're trying to sort through that, again, using very complex arrays of data. And that's what we've been working on, and it will, again, a little bit apply to what we're talking about today.
Give us an insight into this phase 3 data that was presented.
Well, so Anifrolumab is a treatment that affects a very sort of a central way in which inflammation gets played out in the body of a lupus patient. There's a receptor for all of the signals that come from interferons, or type 1 interferons. And this medication dampens the signals that go through this receptor. This happens to be a critical sort of central pathway in lupus. And so they had already had a phase 3 trials that have shown signals of efficacy when you dampen down the signals through this receptor. And not surprisingly, they were able to come up with some kind of biomarker or blood test that you can do to suggest that this was working better in people who had that high type 1 interferon signal. And so that served as the basis for the current study.
Now, this was the Tulip phase 3 trials, is that correct?
Those were the two Tulip phase 3 trials, yes.
Could you expound?
Yes, I can expound. So they already had an overall signal of efficacy, but several questions remained. One of the things that happens when you study lupus is people are not sure with these complicated endpoints that we have. Well, I have a patient and they have arthritis. Does it work for arthritis? Or I have a patient and they have rash. Does it work for rash? Because we have these very complex, intertwined endpoints. So the first thing we wanted to do is take a look at some very simple ways of measuring arthritis and rash instead of a compound endpoint over a whole population. So we wanted to know if, can we demonstrate whether or not this treatment is effective for rash or arthritis? Is one better than the other? Which sorts of patients might benefit from it? So that was the first question. The second question that we wanted to ask was, and what about this type 1 interferon signal? And now we're back to work that, we've been doing for years, but this is actually based on the test that was developed at AstraZeneca. And they're able to take just 4 little set points of how genes express themselves and put them together as sort of a very useful test of this interferon activity. So we wanted to look at the simpler measures of rash and arthritis, and we wanted to look at people who had a high interferon signal and people who had a low interferon signal. And that was the current study, which was taking the data from those phase 3 trials and asking those questions about it. Now, when you look at the measurements for rash and arthritis, you can boil them down into sort of stringent endpoints that are very hard to meet the mark, or endpoints where you can look at partial improvement.
Mm-hmm.
So we applied different layering of, what do we want to look at here? And here's what we learned. We learned that people with a high interferon signal were definitely driving responses to both rash and arthritis, no matter how you looked at the endpoints, whether you were going to look at only major response or partial response. But if you looked at only partial response, suddenly people who did not obviously have that interference signal, we began to see a little bit of an efficacy signal, suggesting that although we had a marker that was somewhat useful in sorting who's most likely to respond, it didn't necessarily rule out other people in the population. I think this sort of underscores that, not two things really, that we don't really yet have the refined technology to pick out every single person who could respond to a drug. But it also sort of suggests that we have some technology that can help us find a more propitious population. But also, if you look at sort of gentler responses or partial responses, you're going to be able to show that a drug might be useful for more people than you thought.
How do you envision this landscape, arthritis and rash associated with lupus, if Anifrolumab is approved?
Well, I think, it's just a little bit helpful to people when they sort through their patients. Arthritis is probably the commonest presenting symptom of lupus. Rash is one of the second most commonly presenting. And when you have a patient, most of the patients have had, all of the patients have had either rash or arthritis, pretty much. When reasonably looking at it. But some have sort of more likelihood of presenting with one than the other at certain times and under certain circumstances. So we've got two major common symptoms. We're able to sort of demonstrate that it works across the spectrum of presenting symptoms. The less common symptoms aren't really uncommon, and we may not have a large enough population to sort through those as well. But in an individual person, usually when they have other symptoms along with rash and arthritis, the person tends to either get better or not get better across the board when they have lupus.
Were there various age groups considered in these trials?
There was a broad spectrum of age represented in the trials. I will say that, and this is true really for many types of drugs given to lupus patients, you're going to get faster and better responses in patients who come in who are what we call serologically active and have sort of exuberant disease. And those tend to be the younger patients. This does not rule out the possibility that an older patient with lupus could benefit. It's just sort of if you have more going on, you're more likely to see an effect, if that makes any sense to you.
It does.
So I would say that we're able to demonstrate efficacy better in a younger population.
Give us a website where our listeners can learn more about AstraZeneca and these trials as well.
www.astrazeneca.com. There's a lot of information there, and I hope people enjoy it.
Well, it's been a pleasure speaking with you briefly this evening. Thank you so much for joining us here on Health Professional Radio, Doctor.
Thank you for talking to me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Joan Merrill. She's joining us here from Oklahoma Medical Research Foundation. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.